Thanks.
Okay, I will show you my small experience in tracheal stenosis. I am thorax surgeon, and I intend to share with you about my experience in tracheal stenosis. Do you see my presentation? Is visible?
No, it's not.
In moment, yes.
Now it is, yes.
Okay. Okay. In the course of COVID epidemic, the complication after mechanical ventilation, very often we meet with problem with tracheal stenosis, cicatricial stenosis, and we try to use several new methods, including hyaluronidase. Our experience is very small, but I mean it will be interesting for our other colleagues, and we okay. The presentation is visible, yes?
Yes.
Hello. Okay. Boże Święty. In this small study, we included 12 patients from our thorax surgical center in Wrocław. These patients are treatment conservative by contraindications for surgical treatment. It was the lack of consent to the procedure or high surgical risk associated with comorbidities or several anatomical conditions like the exceeding diameter of stenosis. It is larger than 6 centimeters. The group is 11 patients. The patient average age 16 years, and no, that's not interesting. But methods. The patients were this complication were after intubation or post-tracheostomy or persistent tracheostomy. You see here the methods in method in detail. You see the cause of stenosis and cause of mechanical ventilation. You see this poisoning, trauma, circulatory failure, heart attack, and other. We have the other groups after sepsa, but not in this presentation. Pathology you see here in this table. The patient has several stenosis in Cotton, according to Cotton classification. It is the grade 2 or 3, nor in the grade 4. This is possible. The light stenosis was not in our group. And we performed this intervention bronchoscopy by under general analgesia, using the tracheal bronchoscopy, And in some patients, we use the hyaluronidase. It is no new method, but usually we use it argon coagulation, dilatation, if most dilatation, expanding in most cases, and sometimes the segmental resection was, but not is this group. Tracheostomy, so the pity, sometimes was the last method of treatment. The effectiveness of this treatment we measured by assessment of diameter of stenosis, presence of dyspnea, on what is the most important number of frequency of the tracheal bronchoscopies that we have to perform several times. It is not cheap, and it is not convenient for patient or for us too. But if you have several stenosis and danger for life, we must perform this procedure. And shortly speaking, we use the hyaluronidase in 4 cases. And she allowed the completion of conservative treatment in 3 of these cases. One of these patients in this group has had to tracheal stent. Here you see the details of our treatment and final results. I like in this green places you see the total healing. The tracheostomy, it not got in our opinion is not got result, and the widening and continuous bronchoscopy it is also not good result. 3 patients are died due to heart attack or hemorrhage. It was hemorrhagic in bronchial tree, and some patients died due to pneumonia. And what is interesting, you see this stenosis, the picture after stenosis. Treatment effects is depending of length of stenosis, and sometimes of method. We use combination dilatation and thermal ablation. Thermal ablation it was the ablation in argon ablation, or sometimes we use only stents. And stents give them us the larger effect, quicker, but it give you see the diameter after the procedure diameter, differences of the diameter of stenosis. The larger 9 millimeter is the most visible, but stents is not so good method for the lung treatment. And if we observe the disease-free time between the interventional bronchoscopies, the best method for patient is combination argon or thermal ablation connected with broadening mechanical extension of the stenosis. And length. Some words about the cost. In Poland, the intervention bronchoscopy like this, it is cost about $1,000. What is this failure here? But the radical resection of stenosis, it is $4,000 or $4,000. Of course, it is a bit bronchoscopy is cheaper, but when we have two here is correct. Sorry, there's a cost here on interventional bronchoscopy and the resection. When we have to repeat 4 times, 10 times, you see how expensive is this method. You have to perform it, but the best method is, in our opinion, is to perform radical resection, but not always it is possible. And short is this, our experience. Hyaluronidase give visible effects, but by smaller stenosis, and we have to perform this procedure often, not in 4, 8 weeks intervals, but more frequently 2, 3 intervals. Give by in procedure give us better effects. And more conservative treatment in our opinion, the treatment of tracheal stenosis required numerous endoscopic and expensive interventions. Thank you for your persistence. Hello?
Thank you very much for sharing your valuable experience with us. It was a pleasure for us. Thank you very much.
If you have some questions of our own experience, I am open, of course.
Not at the moment, but we'll share your presentation online, and if there will be any questions, we'll send it to you, and if you will have spare time, you will be able to answer them.
Okay.
Thank you very much.
Thank you very much.